Okay. Hello and welcome to another wonderful Renewal podcast. Today I'm here with Amanda and Baum. And
hello.
In this podcast, we'll be talking about local anesthesia. We get a lot of clients who want to undergo surgery, but they don't want to undergo general anesthesia. So we're going to talk a little bit about when that's possible and some of the limitations with surrounding local anesthesia. So, Amanda, in general, what procedures can you get under local anesthesia, and which procedures can you not do under local?
Generally, you can only do smaller and shorter procedures under general anesthesia. The best one is actually eyelid surgery. It's actually better for you to be under local anesthesia, and we'll get into that a little more later. Labiaplasty can be done under general anesthesia. Ear pinning, I believe, can be under as well. Not a lot of other surgeries can be done under local, though. I hear people talking about liposuction, but I'll tell you that we've never assisted anyone who's done liposuction under anything except for general anesthesia, and I really don't think it'd be recommended.
Yeah, you see it on price lists sometimes for like one spot, but we've never run into a doctor who's willing to do it.
Yeah, I think about the length of the surgery and the area and the pain level, and that'll give you a good idea of when you should use anesthesia.
What kind of things do you need to do? What kind of things do you need to do to prepare for local anesthesia, say, as opposed to general?
For general anesthesia, local. Sorry, for local anesthesia, like pretty much it's gonna be like general anesthesia that like you have to do pre-op test before you go under the surgery. But as you will not be put in the sleeping, but it would be good if you have someone to be with you after the surgery, because even you're gonna still feeling something, because the doctor will talk to you while he do the surgery, but you might feel like a little bit nervous after the surgery, so it will be good to have someone to be with you after surgery.
Yeah, the preparation for local anesthesia, if you are very nervous, sometimes there's the option of also having a sedative. You're not going to be asleep, you're still going to be talking, but it can kind of calm your nerves. And in terms of preparation, it's not as extensive as general anesthesia. Like, you don't have to fast necessarily, but you shouldn't be eating a big meal and having caffeine, because that would kind of negate the purpose of it.
Yeah, because like most of the time we have the client who want to do the eyelid and say like, oh, sorry, by the way, I just have breakfast or have a coffee this morning. Yes.
Yeah.
Okay, we get people asking us about twilight sedation sometimes. Is that something that's generally available? What's involved with that?
Yeah, I've never had a surgeon offer twilight sedation. It has been asked for several times, and I've heard that maybe it's a possibility for dentistry, but overall with actual surgery, you're pretty much going to just do local or general anesthesia.
Okay. Getting back into dental a little bit, what sort of things can you do in dental that require local anesthesia as opposed to general?
Oh, yeah, that's a good question. Actually, most everything's done under local, but if you have a young child, or if you're really scared of the dentist, if you get it done at the hospital, then you can actually go under general anesthesia. So that's kind of the opposite. Almost everything dental-wise will be done under local, but if you have a special reason, like your age or your nerves, then yeah, you can do general.
Because I actually have the client who like almost 60 and asks for like have the full mouth restored, and then he wants to get it done under general anesthesia, and of course in that part he have to do like the pre-op test before he go under the general anesthesia.
And also consider not every session can be under general anesthesia, so like the main part of it can, but you're still going to need follow-ups and adjustments, and they can't put you to sleep for 3 sessions in a row. Yeah.
One final thing I think we should discuss is cost. Local anesthesia does tend to be cheaper. So if it's available, maybe that's something else to consider.
Just have to keep in mind that general anesthesia will be like double price than local anesthesia, because you're gonna put under the sleep, so it will be more cost to take care during the procedure.
Yeah, and there's also no overnight afterwards, because like Baum said, you go home after. But the most important thing is safety and pain management. So pretty much for anything except for eyelids, labiaplasty, ears, or something very, very small, just assume you're going to have to go under and pay for general anesthesia.
Yeah.
Okay. Thanks a lot, guys.
Thanks.
I hope that helps inform you a little bit about when local anesthesia is possible. And for more information, you can always contact us, info@renewal.com. You can visit our Facebook and our Instagram and our Twitter. Thanks a lot.